It's Saturday, July 5th. I'm Ali Velshi. In the last hour, Dean Obeidallah went and told everybody I'm a naturalized American citizen. So let me tell you a little bit more about me. I grew up in Canada. That's where I was raised. It's where I went to school. It's where I lived there for a big portion of my early life. And so I can tell you, for all the similarities that America and Canada have, healthcare is not one of them. Unlike the United States, Canada has a publicly funded universal health care system. Canada's version is referred to as a single payer system because the government is the single payer of health insurance premiums. Each province or territory in Canada shares responsibility for covering every eligible resident of Canada, covering basic, necessary, and preventative care. You can go to the doctor for a checkup without much of a hassle. Although, like here in the United States, there is a shortage of doctors in Canada. Or you can go to the hospital for an emergency without having to itemize in your head how much every single pill or procedure is going to cost you. Before any of you hit send on your social media posts, it's not a perfect system in Canada. But in general, people receive the care that they need and they don't get stuck with bills that send them into crippling debt. There's no such thing as medical bankruptcy in Canada. And by the way, that's the case for nearly every developed country. We describe those developed countries as being part of the Organization for Economic Cooperation and Development. Its shorthand is OECD countries. They're modern big economies, democracies: Germany, Ireland, Italy, Japan, Portugal, Sweden, even Luxembourg. They all have a universal or near universal health care system. Everybody's entitled to get health care. There is, in fact, just one OECD country that doesn't have some version of health care for everybody, and that is the one we're in right now, the United States of America. The U.S., to this day, lags far behind many, many countries when it comes to providing affordable health insurance for its people. Under America's for-profit healthcare system, we spend significantly more money per capita on healthcare compared to other developed nations, and America's system often produces worse outcomes. That said, America's been making strides toward a better healthcare system for a while. A lot of that is because of the social safety net programs that have helped to prevent millions of Americans from becoming uninsured. 60 years ago this month, Lyndon B. Johnson signed into law the Social Security Amendments of 1965, which created two critical and popular programs that persist to this day: Medicaid and Medicare. The signing ceremony took place at the Truman Presidential Library in Independence, Missouri. Former President Harry Truman was in attendance. That's him on the right, wearing the glasses. Moments after the bill became law, the 81-year-old Truman, who was the first American president to propose a national health care program decades earlier, became the first Medicare enrollee. He was presented with a Medicare card. Over the years, both Medicaid and Medicare have expanded to cover insurance for low-income Americans, people with disabilities, children, the elderly, among other groups. Today, more than 66 million people are on Medicare and 71 million are on Medicaid. Both of them are state-administered programs that go by many different names depending on what state you're in. For example, in California, it's Medi-Cal. In Kansas, it's CanCare. In Tennessee, it's TennCare. Sooner Care in Oklahoma, the Sooner State. Texas calls its program Star Plus. In Louisiana, it's Bayou Health. But regardless of the name, those are all Medicaid programs. And the 71 million people who are enrolled in those programs have made Medicaid the largest single insurer in the country today. The Affordable Care Act, or what some people call Obamacare, also helped the country make strides toward providing health insurance for more Americans. When the ACA was signed into law in 2010, the country's uninsured rate was 15.5%. In 2023, it reached a record low of 7.9%. Now, as many Americans have experienced firsthand, this country's healthcare system is still far from perfect. But it's undeniable that these programs, Medicaid, Medicare, the Affordable Care Act, have led to progress over the years. Progress that could soon be swiftly undone by the One Big Beautiful Bill Act, the GOP mega bill that passed by the slimmest of margins with only Republican votes on Thursday. And yesterday, during a 4th of July event at the White House, Donald Trump officially signed it into law. Despite the GOP's celebrations and promise to cut waste, fraud, and abuse, the One Big Beautiful Bill Act will swell America's deficit, and it'll lead to people losing health coverage and a decline in the quality of care. The nonpartisan Congressional Budget Office, the CBO, estimates that over a decade, the bill will add $3.3 trillion to the national debt and could increase the number of uninsured people to 11.8 million. According to the health policy organization KFF, Other Trump administration policies could actually push that number up to 17 million people. Some will lose insurance because they won't meet the new stricter work requirements and the reporting standards that are included in the GOP's mega bill. Others will find it harder to enroll and to keep their plans under the ACA marketplace. In fact, going forward, people will have to update their information every year. They'll no longer be allowed to automatically re-enroll. Why is that necessary in 2025? On top of that, the One Big Beautiful Bill shortens the annual open enrollment period by about a month. These are efforts to choke off access to the ACA marketplace. They make it harder for millions of people to obtain and maintain health coverage. Medicaid enrollees can also expect more out-of-pocket expenses. The bill includes provisions that require states with expanded Medicaid coverage to charge some enrollees up to $35 for some services. All of these changes and cuts are going to lead to the loss of service and the possibility that some of the country's 760 at-risk, financially strapped rural hospitals could be forced to close, hundreds of them. That's why some Republican senators like Susan Collins fought for a $50 billion fund for rural hospitals, although that may still not be enough to prevent some from closing. The One Big Beautiful Bill Act is a big step backward for this country's healthcare system.